Hi, I'm Angela. I'm the Infection Prevention Control Nurse for Ashford One. I've worked here just 5 months actually, and previously I had a long-standing career in the NHS for 25 years. My role is all things infection control, and that might be something from as simple as coming in the door in the morning and spot checking everybody and making sure everybody's doing what they're supposed to be doing, leading up to more serious things like auditing, implementing policies, adapting our hospital to make sure that we have really infection control on top of everything really. And of course with COVID, that's had an immense impact on my job. A typical day starts at the front door, so I watch and I look and see who's up to what, who's got their masks on, who's washed their hands properly, monitoring the reception staff, making sure they're all happy and doing everything they should. And people know as soon as I come in the door, they're like, they take their watch off or they'll straighten themselves up a bit, you know, they kind of see me as the infection control police, I think. So yes, my job starts the minute I come in the door, and then more pressing things will be opening post, looking at our surgical site infections that we may have had that week, and investigating Datex, making sure that, looking at all of the procedures, making sure we're doing everything we should do, and looking to see what the root cause analysis is for some of those infections. Changing and adapting policies, as I said before, lots of auditing everything from environment to housekeeping, waste management, to the clinical staff. Teaching responsibilities, clinical teaching, so teaching things like sepsis, acknowledgement on the ward and how we deal with that, through to things like PPE, how do we don and doff our PPE appropriately, do we wear the right equipment at the right time, socialising, making sure that we are keeping isolated from people when it's appropriate. And being friendly as well, trying to help and advise people along the way. People will often collar me in the corridor and say, oh, what do I do with this? How do I do that? You know, so it's an advisory role as well. That's a really good question for me, because having worked for the NHS for 25 years, it was a big leap to come and work here. I'd heard through the grapevine, I'd heard the stories, oh, it's so beautiful, it's so lovely, it's so clean, it's all of those things. But actually, when I came here, it was a lot more than that. I think one of the things that drew me to this hospital was the fact that I really like the idea of working in a sort of family environment, if you know what I mean. So I can go and knock on our chief exec's door any moment, I can go and see my head of department at any time. It's a very much an open door policy here. There's no sort of wading through loads and loads of tiers of management to get a decision, so you can quite quickly bring an issue up, deal with it straight away. So it was very much the support. Everyone's visual, I know everybody by first name terms, which is so lovely. But that's not to say that what a fantastic hospital, it's very clean, the facilities are amazing, we've got a fantastic canteen, we've got really good facilities for changing our clothes into, showers, fantastic food when you go up there. Hence I've put on half a stone since I've worked here. So yeah, I think it was just that family feel, that really different way of working, but also ultimately fantastic patient care and all the facilities that allow us to do that really. That's been a tremendous, well, everyone will say the same thing, it's just nothing like we've ever experienced. I was over at the acute hospital when we first had the first wave, so I was actually, unfortunately, right in the thick of it, right in, CCU, ITU, so I dealt with that side of things, and it was unfortunate I actually contracted COVID myself and was in hospital for a while, so I've got first-hand experience of how awful it can be. Luckily to say I came over here healthy and well, and was really so excited to see how this hospital was adapting. So the things that they put in place, even in those early days, the social distancing, of course, the monitoring of patients when they come through the door, our pre-assessment facilities, the outside hut that we have where we can COVID test everybody prior to their surgery, through to all the policies that we had in place. And not just for clinical people and for patients, but also for our own staff. We're very aware of making sure that we're looked after. Our mental health is looked after, which is so important. And we have facilities to do that. So we do talk to our staff about how they're feeling and how they're managing with all of this. Excellent equipment, loads of PPE, which has never been an issue here. So I think we've adapted very well, and we're continuing to learn. I think we're set to work the way we are for the rest of the year probably, and that's not a bad thing. Public perception, obviously they want to see that we're doing the right things.